All right, I'm Dr. Penrose with the St. Joseph Regional Medical Center Foot and Ankle Center, as well as the Wound Healing Center, and I work here in Mishawaka as well as in Plymouth. When you have an increased blood glucose level, which what we see in diabetics, that's very, very hard on the nerves. It causes nerve swelling, and eventually they start to degrade and they suffer irreversible damage, as I had mentioned earlier. And one of the first sensations to go is actually pain. So you can actually feel pressure, you'll be able to feel different sensations in your feet, which makes you think that you haven't lost that sensation of pain. And we've actually had some really crazy stories of patients that have come in who have something in their foot that they didn't realize that they had stepped on, or had even multiple fractures in their feet, and they were unable to, they didn't feel those fractures, but they were able to see that there was changes in the foot, redness and swelling that brought them in, and they were just completely surprised that they didn't have that pain. Now, that's not all diabetics. That just tends to be people who have a high blood sugar for a prolonged period of time. So my biggest recommendation in order to avoid these wounds or avoid trauma to the feet or injury to the foot that goes unnoticed is really to manage your blood sugar. If you have a history of diabetes, it's very important that you have a good relationship with your primary care physician and that you're doing your best to keep that blood sugar within that range of 80 to 120 or whatever you establish with your primary care physician to be healthy. And in my opinion, that is the most important step in guarding against ulcerations.